Whooping cough, causes, symptoms, and remedies. Whooping cough or pertussis is a highly contagious bacterial infection affecting the lungs and airways, especially in babies. It can last for over 2 months, causing severe coughing fits. The bacteria, Bordetella pertussis, causes it by attaching to the respiratory tract cilia, releasing toxins, and causing swelling and mucus secretion. Whooping cough spreads rapidly, and infected individuals can infect up to 90% of a group. The disease can spread through contact with an infected person's breathing fluids, coughs, or sneezes. Early symptoms include a sore throat, blocked nose, runny nose, low fever, and watery eyes. As the infection progresses, the coughing becomes severe and rapid, causing choking and breathlessness, sometimes turning the face blue, cyanosis. Treatment involves antibiotics and isolation to prevent the disease's spread. The antibiotics azithromycin and erythromycin can help, while small meals, fluids, and rest are crucial. Vaccines DTaP and TAP offer protection. Serious cases require immediate hospitalization for monitoring, oxygen provision, mucus removal, and fluid administration to prevent complications.